if we get this because of that accident, it'll be in their memory, and good things come from it. A positive thing comes from it. I mean, it'll save a lot of lives down the road, I'm sure.
That is Ray Muirhead. He's the mayor of Carberry. He's talking about a commitment from the province that was announced last week to build an overpass at the intersection of Trans-Canada Highway and Highway 5. In 2023, at that spot, 17 people, mostly seniors, were killed after a bus and a semi collided. Now, ever since, local residents of Carberry and the town's council have been calling for an overpass to make the stretch safer for drivers. Last week, the province laid out its plans for the more than $100 million project. It was welcome news to Mayor Muirhead and many others in his community. But some of the other promises in the throne speech are drawing skepticism. I'm Marcy Marcusa. This is Manitoba. And today on the podcast, we're going to hear more from the Premier on his government's plans for the province. Kinew's third speech from the throne is big on vision, touching on things like safety, energy projects, affordability. But let's hear more about his plans for healthcare first. Kinew says the province will end mandatory overtime for staff, starting with nurses. While by and large workers support the idea in the long term, as you can imagine, they do also say they're not sure it's realistic right now.
The Manitoba Nurses Union backs ending mandatory overtime for healthcare workers, but says the system still doesn't have enough nurses to make that happen. Yesterday's speech from the throne commits to beginning the process of ending mandatory overtime, starting with nurses. Premier Wab Kinew argues the healthcare system has enough nurses to support a change in legislation. Earlier this year, the province announced it had hired 481 nurses in the previous 10 months. Union President Darlene Jackson says her members still aren't noticing a difference at work.
I would love nothing better than to see an end to mandating. But I don't think we're in a position now where we can legislate an end to mandating and still have a functioning healthcare system. I think there's other things that need to be dealt with, and one of them being culture. Once we have recruited enough nurses and we can retain them, then mandatory overtime for sure.
The province has also pledged to legislate staff-to-patient ratios in priority areas, and Jackson worries what that might mean for departments that are not prioritized.
I asked the Premier about that skepticism.
For the first 2 years in government, we've added 3,500 frontline staff, and there's more than 1,200 new nurses there. We're spending more money on healthcare than ever before. So the resources are there. It's just about using it correctly. And the nurses, the healthcare aides, the physicians, they're all doing an amazing job. They're all frontline heroes. We just need to push the management, the people running our health authorities, to properly allocate the resources to where they're needed. So we didn't do this on day one because we knew we needed to add the staff first. But now that we're a couple years into that, we've seen the numbers increase in a very positive way. Now we're going to put those standards into place, and we're going to ask management to hit those targets. And again, this isn't about anything other than trying to make your care better, because we want the nurse or the healthcare aide, healthcare professional working with you to be able to have good work-life balance, to be able to recharge. You know, the thing I always point to is none of us would get on a plane if the pilot had been forced to work back-to-back shifts. So why would we say that that's okay when we go to the emergency room, that a nurse had been forced to work back-to-back shifts?
How soon will these change? Will frontline nurses see these changes?
Well, we'll start rolling it out in the coming year. So we're in the legislature this fall, resuming after the holidays in the spring session. And so we'll be bringing these legislative changes forward.
If misallocation of staff is the issue here, if you're saying there's enough people now that we don't have to, as you heard the concerns, even coming from the union, that, 60% of new nurses leave the profession within 2 years. And there's fear from the union, while they see it as positive, that we're going to have...
We've only been in power for 2 years.
Well,
so you have to consider the fact that we've changed the attitude towards recruitment and retention. We have a recruitment and retention office. So again, you're looking at backward statistics that point at the PC time in office.
Okay.
We're trying to send a message to the front lines. You want more help at the bedside to take care of these patients that you care for? Great. We're going to deliver them. You want more work-life balance? We're going to implement that into law.
I guess if even you have the union, though, saying that it is... a positive idea, but that they're
I'll
worried
take
that
it.
things will be empty, that we're going to have healthcare facilities that don't
don't
have
think so.
staff.
No.
So tell me why you don't think so, because they're saying we
Because
don't
nurses,
have the numbers yet. Premier.
No, we do have the numbers. Again, more than 1,200 new nurses. This is what everyone's been asking for a long time. So we got the numbers. That's not in question. And, you just look at a nurse, you look at a doctor, you look at a healthcare professional. They care about their patients. They're not going to let somebody fall through the cracks, right? The issue is the hospital administration. We've been giving them all the money. We've been giving them all the staffing resources. We've been giving them the direction. It's time for them to show results. So we love the front lines, but this is really about the management of our hospitals and regional health authorities. They have to start showing improvement.
How will you crack down then on what is you're alleging mismanagement, really misallocation of staff? If they're the solution, how will you set targets or timelines for how they have to achieve with existing staff what you're hoping to achieve?
Yeah, exactly. First and foremost, it's that patient safety charter. You go to the emergency room, God forbid, but you go to the emergency room to get help, to get well. And so we want to outline what you should expect there, first and foremost. And then in terms of you getting that safe, healthy care for you, you need good staff to deliver that. And that's where those other two pieces come in. One is ending the mandatory overtime so that nurse has not been run off their feet on 2 back-to-back shifts, or the healthcare aide or healthcare professionals. And the other is staff-to-patient ratios in priority aspects of the healthcare system. So when we can bring that into place, that's going to guarantee, in the emergency room, you're in the ICU, there's going to be enough staff there to take care of you instead of having people spread too thinly. So we did the first steps around educating, retaining, recruiting staff. We have many, many more people in the system now. And now we're sort of pressing forward on making sure that the administration deploy those people into the right areas. And again, rather than forcing frontline people, like how mandating overtime was being used, we're going to put the incentives, we're going to put that overall structure into place so that people would voluntarily step up, and we'll get the staffing outcomes that we want to see, and you'll get the health care that you need.
Beyond healthcare, the Premier is also committed to balancing the budget in 2027, he says. But he's made a lot of promises to tackle affordability in the province, with no tax increases in the spring budget. Plus, there's a new effort to help Manitobans, he says, with the rising cost of living. The province plans to commission a study that's going to help you save on groceries. So I asked him about that too, but also about how much of it is really within his provincial government's control. You might know from your grocery bills that basic grocery items are already exempt from PST, but things like snacks and frozen food are taxed. Many price spikes come down to factors outside of the province's control. Beef, for example, got way more expensive. It was up 14% year over year in September, and that's because of pricier feed and more persistent droughts shrinking herds in Western Canada. The price of coffee increased 28.6% over the past year, but that is due to supply issues in major exporting countries like Brazil and Vietnam. Premier Wab Kinew says he doesn't have the answers for how just yet, but his government is looking at what's possible.
We all see what's happening with the price of groceries. And so I think the first step is just to make sure that the steps that we're going to take in these budget measures are going to be the right ones that will actually make a difference for consumers. There are, like, a provincial government can't do everything, right? Like
you can consider removing the PST from grocery store bills. Is that where we're leaning? Is that where we're going?
You'll see the specific details on budget day.
Is that something you're considering?
Well, I think when we look at the gas tax cut, that put money in people's pockets. That stopped runaway inflation in Manitoba. So, my left-wing economics profs are not going to like this, so the fact that I was their student 20 years ago or whatever, but the reality is you cut consumer-facing tax, it helps people. And so, that's certainly one thing we'll look at. But
so I need to confirm this as a journalist. The PST is on the table?
Well, I think the first thing that we're announcing here is a study, because who are the large players? Do we have enough competition amongst those big chains?
Okay.
I was there 6:30 in the morning. A lot of excitement at the new Costco. People are serious about saving money. People are serious about competition in the grocery store. So that'll be one thing we look at. You got the independents, the local grocers. We want to see what's going on there. Are there things with our distribution system? We do a lot on the ag side too, freezing ag crown land lease rates for beef producers. We've seen what's happening with the price of beef. We're trying to do what we can at the provincial level to control the costs that are the inputs for the beef producers.
So there's a number of measures.
It's going to have to be a comprehensive approach. Yeah, it's a big challenge for
more
people.
Details in the spring. I know you dodged the tax question here, so I won't ask it a third time. As we continue to dig through this throne speech, the province has also vowed to follow through with plans to open a supervised consumption site in Winnipeg in January. This will be Manitoba's second attempt, though, at introducing this kind of a facility in the city. It had applied for licensing from Health Canada, you might recall, about a year ago. This was for a site over on the Disraeli Freeway. But that plan faced a lot of pushback from the community.
Carly Anderson's daughter is in grade 12 at Argyle Alternative High School. It's located across the Disraeli Freeway from the building selected to house a supervised consumption site. The school division was informed, but the decision to put it here isn't sitting well with Anderson, who also lives in nearby North Point Douglas.
Well, I'm very disappointed that they haven't sat down with the community as a whole. We do have many concerns.
The site would provide a place where people can go to inject their own drugs in the presence of trained staff and access healthcare, mental health support, and long-term addictions treatment. Anderson isn't against the concept of a supervised consumption site, but worries about the impact on the neighborhood.
So what does that mean for the public? What will they be seeing?
A family physician specializing in addictions treatment says it's normal for people to be worried about a rise in violence, loitering, and needles on the ground. Dr. Jeanette Poulin argues it'll have the opposite effect.
We don't see an increase in violence in those areas because people are connected into care and connected to treatment.
The goal of this site and others like it is to prevent accidental overdoses and save lives, something area resident Brad Schultz supports.
I'm okay with it. I think with all the toxic substances that are out there now, I think it's a good idea.
Any stakeholder within 500 meters of a consumption site has to be consulted under federal rules. Stephanie Kazar, a council member for this nearby church within that range, wishes they would have been talked to before the decision was announced.
The location isn't a surprise to the church council. What was a surprise was that we were not consulted.
And so the province scrapped its plans for that location in September. So it's going to have to go somewhere else. The Premier wouldn't tell me where his government plans to put it, though he says he's confident that the revised project will get the green light from Ottawa in time for January. He says what is clear is where it's most needed.
I mean, you drive up Main Street and you see a humanitarian crisis. It's just awful, the way folks are living out on the street. And you got the Salvation Army, you got Siloam Mission, you have Main Street Project. So it's pretty clear that that's where the need is. And so where do we locate a facility in that general area? But it's not going to be right across the street from a school or a childcare center. That's what we've been working on. But we've done a lot of outreach. We campaigned on this. This is a well-known thing that the addictions medicine doctors tell us is one of the tools. Again, it's not a silver bullet, but it's one of the tools that can help save lives. So we're investing in recovery. We gave all the media a tour of the Sobering Center earlier this week, so that's a part of the solution too. We have enforcement, we have prevention, we have other forms of harm reduction, and now this is one more tool that we can add to that comprehensive approach to just try and help people get well. And you know what? The idea of supervised consumption is one part of it, but part of it is also just getting people health care. If people are living a high-risk lifestyle where there's drug use, where there's needles and stuff like that, they need to see a doctor. They need to see a nurse practitioner. And so connecting them with those services as well as talking to them about recovery and treatment is part of the mission here.
In your view, if there are still people that are worried about having something like this in their neighborhood, and I'm not just pushing at the not in my backyard thing, but my question to you is what don't they understand about the impact then? If it's not going to be an issue, what would you say you would like?
I think people are smart. I don't know that it's that they don't understand. What I would just say is this doesn't happen in a vacuum, right? The alternative to having a supervised consumption is to have unsupervised consumption in the street. That's the alternative because that's what we have now. I prefer to have, this behavior that's causing harm. I prefer that having that behind closed doors under the supervision of medical professionals instead of us all driving by it on our commute home from work.
There's also more slated here for energy infrastructure. A lot more. The speech commits to building a $3 billion fuel generating system in Westman. That's bigger than Manitoba Hydro's existing plan for a new station, and it's all to prevent the province from eventually running out of power in winter months. I asked the Premier about his vision for the energy sector. He starts off by explaining why that money isn't being invested in another hydro dam instead.
Well, because a hydro dam will take 20 years. Is the short answer, and we need energy today. This is really about Trump-proofing our economy in a couple big ways. One, we are starting to see the impacts of the tariffs. And yeah, there are tariffs from China as well too. So this is a complicated international situation. So how do we as government counteract that impact of the tariffs? Well, one of the ways is let's get to building stuff. So a $3 billion construction project in the Brandon area, that's a lot of jobs. That's a lot of hard hats and steel toe boots. That's a lot of tradespeople going to work, building something that we actually need, which is power. And that comes to the second point of Trump-proofing our economy. During the coldest days in the winter to heat our homes, we routinely import power from the States. And given what's happened with that trade relationship for the long-term security of our province, we don't want to be dependent on heating our homes based on what's happening in America. So this helps us on two fronts. It helps us with the energy security, and I'd extend that to actually say sovereignty, just to be independent of the states, and then it helps us with the economy.
I know that you have said that you hope the facility will eventually be fueled with cleaner renewables. Why not now?
The hydrogen industry does not exist in Manitoba. So that's the first alternative fuel. And then the second is renewable methane, which there is an early stage proponent, I should say, in the Brandon area working on renewable methane. So that one might actually come online relatively soon. Like not overnight, but like in the next, 3 to 5 years type of thing.
How much are you still exploring wind power here?
Oh, we're building wind, like no question. Actually, in January, Manitoba Hydro will be announcing the first tranche of people they're going to work with on standing up new wind farms. And just as a reminder for folks, 600 megawatts of wind, that's about 4 times the capacity of wind we have in the province right now. So we're dramatically expanding wind power, but it's just to have that security, to have that economic boost, we got to do these combustion turbines as well too. And so it's about Trump-proofing the economy and making sure we got the energy we need to grow.
I want to play you a clip, actually. This is as we turn our attention to Churchill.
Yep.
Obviously, you and Prime Minister Carney met this past weekend. But we did hear from Suyik Au yesterday on CBC, Associate Producer of Finance with the U of M, University of Manitoba. Here's what he had to say about the Churchill project right now.
Okay.
We're competing against very large cities and very large projects, which have clear stakeholders that are pushing it. And Manitoba is kind of the middle child of Canada, where, we're not the biggest, we're not the most sophisticated, we're not the most athletic. We're the little middle child that gets ignored. And so we need to be able to step up and try and make ourselves a priority by having Wab Kinew and the MPs in our province speak as loudly as possible for the importance of actually pushing infrastructure like the port.
And pardon me, because I misspoke there, associate professor, not associate producer.
He lost me at the start when he was saying we weren't sophisticated, but then he got me back on at the end when he was being complimentary.
So,
not athletic. Hey, what did we do to him? Come on.
Let me ask you this. So you meet with Mark Carney this past weekend. I know there's a lot of talk about Churchill.
Yeah.
He reaffirmed the commitment to the port expansion, but the reality is we're not on the list. I mean, we had 2 lists now.
I don't know why everyone keeps saying that.
Well, the major projects list came out, and if you look down at what's on them,
well, look at the first one. We're on the list. They announced 11 projects, and we're on the list. We've been working with the Major Projects Office for several weeks, actually.
Churchill's not on the list, but
No, it is. Churchill Plus is in the first list of projects announced.
Churchill Plus
yes.
is compare that, Premier, for us to Churchill the Lines and enlighten us.
No, there's only one Churchill project.
The whole thing is on the list then.
Go back to Prime Minister Carney's announcement of the first tranche of major projects in September. Churchill is part of that list.
Just jumping in here in case you are confused. This month, Prime Minister Mark Carney announced 5 major resource development projects that his government has recommended for approval. There are 3 out east. There's a hydro project in Iqaluit, 3 in BC. Churchill is not mentioned. The Premier is referring, though, to the announcement that we heard in September. So that's when the Prime Minister announced his first list of so-called, quote, nation-building projects to fast-track. What are they? Well, they are 5 major infrastructure builds. They range from increasing production at an LNG plant in Kitimat, BC, building a copper mine in Saskatchewan, expanding the Port of Montreal, and the Red Chris mine in northwestern BC. So for the vast majority of those 5 projects, development's actually already well underway, and it's something the opposition has criticized and Carney's government has defended, saying these ventures just need a little extra push across the finish line. You're probably still listening for Churchill. Now, beyond those 5 projects, the Prime Minister's office included several, quote, strategies for projects that could be truly transformative for this country, end quote. They said those, though, require further work before getting approval. That is where the Port of Churchill is mentioned. Okay, back to the Premier.
Since then, to explain this, we've been working with the Major Projects Office in Calgary to define the opportunity and to make sure that all the legwork is getting done. When the Prime Minister was here, we specifically announced a feasibility study on ice-breaking capacity. This is going to be kind of the crucial turning point, I think, in making this opportunity become real, take off to the next level. It's figuring out what kind of icebreaker do we need to expand the shipping season. Because if we can take the shipping season and grow it much longer, then all of a sudden the exporters are going to line up. And so this is a really important priority for us. We've been working with the Arctic Research Foundation on the icebreaking capacity. We've been working on the marine conservation area to ensure that we grow the shipping season and the increased tanker traffic while still looking out for the beluga and the polar bears. Maybe next time the Prime Minister comes, we'll put up a banner saying Churchill is on the list.
It's under the list
the
of
work
projects
is happening.
It's under the list. Everyone's saying it because it's on the list, Premier, of what's under consideration. That came out, the Churchill Plus in future. But we did all of the reporting at the beginning. I mean, if you look at the list, Manitoba's not on either of these lists officially.
It's on the first list. And again, so what does the list mean? The list means that you work with the Major Projects Office, right?
The
We're
list
working
means that
with the Major
officially this is
Projects
happening
Office.
and going to be a priority. Our understanding, and if that's not your understanding, that's more critical. It doesn't matter what I think.
Yeah, we're working with the Major Projects Office, and we're building up Churchill. So again,
you consider
the media
us on the list in the same way as like the Red Chris mine in BC and all
open
these.
Open his Instagram. What does his Instagram say this Monday or Sunday whenever he was here? It says, "I want the Port of Churchill built."
So the folks in Churchill who are listening, what's the first phase of what will happen then out of the
it's the icebreaking capacity study that we're doing this winter. Again, for a long time, people have said you need like a multi-billion-dollar ship to open up the sea lane. But I think some of the more recent information we've been getting is it's probably not to that extent, because this is not multi-year ice we're talking about. You know, this is ice that opens up during the summer months, and so it seems like if there's a much more affordable icebreaker that we could get in northern Manitoba, that reality becomes a lot closer, and that's pretty exciting for the province.
Thank you for being here.
Yeah, thanks for having me back.
That is it for this week. This is Manitoba, hosted by me, Marcy Marcusa. Love it if you would take a chance to follow us wherever you get your podcast. Tell your friends, your family, maybe tell your neighbors. We will be back again next week with a brand new episode. And thank you so much for listening.